You wake up, you reach for your phone, and for a second the screen is just a blur. You blink a few times, rub your eyes, and it clears. Eventually. You tell yourself it's normal. It's just age. Everybody's eyes get worse eventually, right? But what if I told you that some of what you're calling just getting older is actually something your body is doing to itself? Every single night while you sleep. Not from a screen. Not from sunlight. Not even from the years themselves. From something quieter. Something happening deep inside the eye in the dark while you think you're simply resting. Here's what almost nobody explains clearly. The retina, that thin, delicate layer of tissue at the back of your eye that actually captures light and turns it into the picture you see needs oxygen and nutrients delivered to it constantly. And as we move past our 60s, that delivery system starts to slow down. Circulation drops. Inflammation creeps in. And the cells responsible for your sharpest, clearest vision begin to wear down. Slowly. Quietly. Often for years before you ever notice a real difference. And by the time you do notice, the headlights that suddenly look like starbursts, the menu you have to hold at arm's length, the 15 minutes it takes for your morning vision to actually focus. A lot of that wear has already happened. Here's the part that surprises people most. There's real growing research into how certain everyday fruits, some of them probably sitting in your kitchen right now, may help support your eyes precisely during that overnight window when repair is supposed to be happening, not as a miracle cure, not as a replacement for your eye doctor, but as something worth understanding because most people have never been told any of this. Today, we're counting down 7 of them, starting from the fruit that gets the least attention to the one that may matter most. Let's be honest about something first. Vision changes after 60 are common. The American Optometric Association has long recognized that conditions like dry eye, cataracts, and macular degeneration become significantly more common as we age. That much isn't controversial. It's well established. What's less talked about is why the damage tends to concentrate overnight and what that actually means for you. While you sleep, your body is supposed to be doing repair work across nearly every system. Your muscles, your skin, your brain, and yes, your eyes. But repair requires resources. It requires blood flow. It requires oxygen. And in aging eyes, that delivery system doesn't always keep up with the demand. Researchers studying age-related eye conditions have pointed to a few consistent culprits behind this slow decline. Oxidative stress, low-grade chronic inflammation, and reduced microcirculation to the retina. These aren't rare exotic problems. They're part of ordinary aging, but they're also processes that respond, at least to some degree, to what you eat and when you eat it. Now, I want to be careful here because this industry is full of over-promising. Eye drops, stronger prescriptions, and in some cases, surgery. These all have their place, and if you're experiencing vision changes, please see a licensed eye care professional before changing anything about your routine. Nothing in this video replaces that relationship. But what the research does suggest is worth talking about is that certain fruits contain compounds your eyes may be able to use, especially in the hours before sleep, when your body shifts into repair mode. Not because of any single miracle nutrient, but because of a combination of antioxidants, natural pigments, and hydration that appear across a number of smaller studies to support healthier circulation and reduced oxidative stress in and around the retina. So let's go through them, one at a time, starting with number 7. Number 7 on our list is one you've probably walked past in the grocery store 100 times without a second thought. Kiwi. Small, slightly fuzzy on the outside, easy to overlook. But for aging eyes, kiwi carries a surprising amount of nutritional weight. Here's the mechanism worth understanding. As the retina ages, it becomes more vulnerable to oxidative stress, essentially a kind of cellular wear and tear caused by unstable molecules bumping around inside your cells. Over years, this wear can contribute to the blurriness, light sensitivity, and slow-to-clear morning vision that so many people over 60 describe. Kiwi contains 2 pigments that eye researchers have studied closely for decades, lutein and zeaxanthin. These compounds accumulate specifically in the retina, where they appear to function almost like an internal pair of sunglasses, filtering certain wavelengths of light and offering some antioxidant protection to the tissue behind them. Let me tell you about a patient I'll call Grace. She was 68, active, sharp as anyone I knew, but she'd started avoiding night driving. Headlights had become unbearable, and she felt like she was losing a piece of her independence over something she couldn't quite explain. We talked through her diet, her sleep, her screen habits. Nothing dramatic, but small, consistent changes, including working more gluten-rich foods into her evenings, were part of a broader approach that, over time, she felt supported her comfort in low light. I share that not as proof of anything, but as the kind of everyday story that got me looking more closely at this topic in the first place. Some smaller studies looking at kiwi consumption in older adults have reported improvements in measures of eye comfort and visual sharpness, alongside less morning dryness. Though, as with most nutrition research, these studies tend to be limited in size, and results should be interpreted cautiously rather than as guaranteed outcomes. So, how might you use this practically? Golden kiwi tends to carry more lutein than the green variety, and it's gentler on the stomach in the evening. Many people find eating one or two about an hour before bed fits naturally into a wind-down routine. And here's a small detail worth knowing. The thin layer of flesh just beneath the skin contains a concentrated amount of antioxidants. So rather than peeling deeply, many people simply scoop the fruit out with a spoon, leaving that inner edge intact. Nothing dramatic. Just a small, ordinary fruit that may be doing more for you than you realized. Number 6 is one almost everyone already loves: watermelon. If you've ever wondered why your vision takes an hour to fully sharpen after you wake up, this one is worth hearing. As we age, two things tend to happen together. The eyes dry out more easily, and blood flow to the retina gradually slows. That combination is a major contributor to that frustrating, lingering morning blur so many people describe. Watermelon is over 90% water, so basic hydration is part of the story. But there's more to it. Watermelon is also one of the richest natural sources of lycopene, a carotenoid antioxidant that some observational research has linked to reduced oxidative damage in retinal cells and to potentially protective effects related to age-related eye conditions. It's worth stressing that this is associative research. It shows a pattern, not a guaranteed cause and effect. There's also research suggesting that certain compounds in watermelon support nitric oxide production, which plays a role in relaxing blood vessels, potentially improving circulation, including in the small vessels that feed the retina. In practice, many people enjoy a cup or two of chilled, seedless watermelon around 30 minutes before bed, without added salt, since excess sodium has been associated with higher intraocular pressure, something the Glaucoma Research Foundation has flagged as a meaningful risk factor worth monitoring, particularly for anyone with a family history of glaucoma. And don't be too quick to discard the rind. The white portion closest to the skin contains citrulline, an amino acid connected to healthy blood vessel function. Some people blend it into a smoothie, others pickle it. Either way, it doesn't need to go to waste. Number 5 is one most people in the West have genuinely never bought: black currants. Small, deep purple, and easy to overlook on a produce shelf. But when it comes to eye health in dim light, they've earned real scientific attention. The specific issue black currants seem to address is low-grade inflammation around the optic nerve and reduced blood flow to the retina. The kind of chronic, quiet inflammation that doesn't show up as pain, but slowly shows up as blur, halos around headlights, and eye strain in dim rooms. It's the kind of problem a stronger glasses prescription simply can't fix because the issue isn't focus, it's circulation and inflammation. What makes black currants stand out is their unusually high anthocyanin content, the deep purple pigments responsible for their color. In eye-focused research, anthocyanins have been studied for their potential to calm inflammation, support healthy blood vessel dilation, and assist in regenerating rhodopsin, the visual pigment your eyes rely on to adjust between light and darkness. Some clinical research involving people with glaucoma has explored black currant anthocyanin supplementation over extended periods and reported improvements in blood flow to the optic nerve, along with a slower rate of visual field decline compared to those not taking the supplement. Separate smaller studies in people with normal tension glaucoma have reported improved retinal blood flow without negatively affecting eye pressure. These findings are genuinely promising, but they come from a relatively small body of research and shouldn't be treated as a substitute for prescribed glaucoma treatment. I think about a patient, I'll call him Walter, who mentioned, almost in passing, that he'd started struggling to walk from a bright kitchen into a dim hallway without pausing to let his eyes adjust. It's such a small, unremarkable complaint that most people never mention it to anyone. But that slow adaptation between light and dark is exactly the kind of thing this research is looking at. If you want to try incorporating black currants, fresh ones can be hard to find in most grocery stores, so many people use a standardized black currant extract in the evening, ideally alongside a small source of healthy fat or vitamin C, since nutrient pairing tends to matter for absorption. As always, if you're considering a supplement, it's worth checking with your doctor first, especially if you're on any eye medication. Now, quick pause before we keep going. If any of this is landing for you, a quick like genuinely helps more people find this video, and it takes about 1 second. All right, let's keep going, because the next few fruits are the ones people ask me about the most. Number 4 is one you almost certainly already have at home: blueberries. But here's what surprises people. Many of us are eating them in a way that actually works against their benefits. Blueberries are primarily studied for their effect on oxidative damage in photoreceptors, the specialized cells in your retina responsible for fine detail and adapting to changes in light. Years of light exposure gradually wear down your body's natural antioxidant defenses, and that decline is part of why so many people find themselves squinting at text or struggling in low light as they get older. The compound getting the most attention in blueberries is pterostilbene, which is chemically related to resveratrol but appears in early research to be more bioavailable, meaning more of it may actually reach the tissues that need it, including, potentially, the retina. Some research has looked at daily wild blueberry consumption in older adults over several weeks and reported modest improvements in visual comfort and reduced eye strain during screen use in low light. Promising, but based on studies too small to draw firm conclusions from. Here's a detail worth knowing. Smaller, wild blueberries tend to carry a notably higher concentration of these antioxidant compounds than the large, glossy cultivated berries most commonly sold fresh. Frozen wild blueberries are a perfectly good and often more affordable alternative. And here's the part most people get wrong: pairing blueberries with dairy. The proteins in milk can bind to anthocyanins and interfere with how well your body absorbs them. Many people find that briefly freezing and then thawing blueberries, rather than eating them fresh off the stem, helps break down the cell walls and may improve how accessible those antioxidants are to your body. A small handful, maybe a third of a cup, about 45 minutes before bed, on its own rather than mixed into a dairy-based dessert, is a simple way to work this into an evening routine. Number 3 surprises almost everyone: dragon fruit. Bright, exotic looking, and depending on the variety. Potentially useful for something very specific: supporting oxygen delivery to the eyes overnight. If you regularly wake up with heavy, tired-feeling eyes even after a full night's sleep, this is worth paying attention to. And the variety matters here. You want the red-fleshed dragon fruit, not the white-fleshed kind, since the compound we're interested in is concentrated in the red pigment. The issue in question is sometimes described as reduced oxygen delivery to retinal tissue during sleep. When that happens, you can sleep a full 8 hours and still wake up with eyes that feel fatigued, with peripheral vision that seems duller than it should be. Red dragon fruit is rich in betalains, a class of antioxidant pigments that some research suggests may support nitric oxide production, the same molecule involved in relaxing and widening blood vessels, including the small capillaries that feed the retina. Wider, healthier capillaries, in theory, mean better oxygen and nutrient delivery during the deep repair stages of sleep. Some early research has explored red dragon fruit extract and reported improvements in measures of ocular circulation and contrast sensitivity over several weeks. Encouraging, though this remains an early and limited area of study. not something to treat as settled science. If you try it, half a red-fleshed dragon fruit about an hour before bed is a reasonable place to start. And here's a detail most people skip entirely. Chew the small black seeds rather than swallowing them whole. They contain omega-3 fatty acids and magnesium, both of which are relevant to nerve health, but only if they're actually broken down during digestion. Number 2 has thousands of years of history behind it. Goji berries. Bright red, slightly sweet, and used in traditional medicine for centuries, specifically in relation to eye health. And modern research is starting to take a closer look at why. The specific concern here is thinning of the macula, the central portion of your retina responsible for the sharp, detailed vision you rely on to read, recognize faces, and see fine color. Over time, oxidative stress and reduced circulation can gradually wear down this tissue, which is part of the underlying process behind age-related macular degeneration, one of the leading causes of irreversible central vision loss in older adults. What sets goji berries apart is their exceptionally high zeaxanthin content. While lutein tends to protect the broader retina, zeaxanthin concentrates specifically in the macula, meaning it may offer more targeted protection to the exact area responsible for your sharpest vision. Some research following older adults who consumed dried goji berries several days a week over a few months has reported measurable increases in macular pigment density, a marker connected to macular protection, along with stable disease status among participants during the study period. These are encouraging findings, though again, based on a modest body of research that would benefit from larger, longer-term studies. I think of a patient I'll call Miriam, who'd been told her macular degeneration was early stage and felt like that phrase alone took away her sense of control. What helped her wasn't a single food. It was understanding that there were things within her influence, alongside her ophthalmologist's care, not instead of it. If you want to try goji berries, soaking 2 tablespoons of the dried fruit in warm water for about 10 minutes softens them and makes them easier to digest, especially later in the evening. Some people pair a small serving with a square of dark chocolate, at least 85% cacao, since flavonoids in cocoa may support the absorption of zeaxanthin, though this pairing effect is based on more limited preliminary research. And finally, number 1. The fruit that tops this list is one that's neither exotic nor expensive: papaya. You may have one on your counter right now, but eaten the right way, it targets one of the most overlooked contributors to blurry vision and early cataract formation: glycation. Glycation is the process by which excess blood sugar binds to proteins in your eye tissue, forming compounds that, over time, can contribute to clouding of the lens and gradual degradation of the retina. It happens quietly and continuously, especially in people with elevated blood sugar, and it's one of the more underappreciated pieces of the aging eye puzzle. Papaya contains papain, a naturally occurring enzyme studied for anti-inflammatory and protein-modifying properties. It also provides a meaningful combination of vitamins A, C, and E, along with folate E nutrients that research has consistently connected to tear film stability, retinal protection, and reduced oxidative stress in the eye. Some research looking at evening papaya consumption in older adults has reported lower markers of glycation on follow-up testing, along with improved tear production and modest gains in contrast vision after several weeks. As with the other findings in this video, these results come from a limited number of studies and should be understood as promising early signals rather than guarantees. To use it, about a cup of ripe papaya cubes an hour before bed is a reasonable serving. Fresh is better than processed, and room temperature is better than cold. Refrigeration tends to slow enzyme activity. So many people take papaya out of the fridge 30 to 60 minutes before eating it. As with blueberries, it's best kept away from dairy for the same absorption reasons. A squeeze of fresh lime juice is a nice addition too. The vitamin C may support your body's absorption of vitamin A, and it simply tastes better. Now, before we wrap up, there are 5 practical guidelines worth knowing, because eating the right fruit at the wrong time, or in the wrong way, can genuinely blunt its benefits. The first is to avoid pairing these fruits with high calcium foods. Eating papaya or blueberries shortly after milk, yogurt, or fortified cereal may reduce your body's absorption of lutein and zeaxanthin, since calcium can interfere with how these nutrients are taken up. Giving yourself roughly 90 minutes of separation between dairy and these fruits is a simple habit that may help. The second is to include a small amount of healthy fat alongside your fruit. Many of the key compounds we've discussed are fat-soluble, meaning your body needs some fat present to absorb them efficiently. A few walnuts, a teaspoon of flaxseed oil, or a slice of avocado alongside your fruit may meaningfully improve how much of these nutrients your body can actually use. The third is to wash gently. Aggressive scrubbing under hard-running water can strip away surface antioxidants, particularly on blueberries and black currants, where many of the protective compounds sit close to the skin. A gentle rinse under cool water right before eating rather than hours in advance tends to preserve more of the benefit. The fourth is to favor room temperature over cold, particularly for papaya. Refrigeration slows enzyme activity, so letting fruit sit out for 30 to 60 minutes before eating allows those enzymes to be more active when they reach your digestive system. And the fifth is timing. Many people find that eating fruit 60 to 90 minutes before bed strikes the right balance, early enough that digestion doesn't interfere with deep sleep, but late enough that these nutrients are still active in your system when your body enters its overnight repair processes. Let's bring this together. Blurry vision isn't simply something you're required to accept as an unavoidable part of aging. In many cases, it's connected to specific identifiable processes: oxidative stress, inflammation, reduced circulation, and glycation. And there's a genuine, growing body of research suggesting that certain fruits, eaten thoughtfully and at the right time, may offer meaningful support to your eye's natural overnight repair processes. Imagine reading without holding the page at arm's length, driving at night without that quiet anxiety behind the wheel, waking up and actually seeing clearly within minutes, not hours, looking at the people you love and seeing every detail of their face. That's really what this is about. Not just clearer vision, your independence, your confidence, and the quality of your everyday life. Have you noticed your own vision changing with age? What's helped you, or what have you struggled to find real answers for? I'd genuinely like to know. Tell me in the comments. And where are you watching from? Drop it in the comments below. If this video gave you something worth thinking about, a quick like helps this reach more people who need to hear it, and subscribing means you won't miss the next one. We cover topics like this every week. And if there's someone in your life over 60 who's been quietly struggling with their vision, consider sharing this with them. It might make more of a difference than you'd expect. I'm Dr. Josephine, and this has been Josephine Healthcare. Remember, nothing here replaces a conversation with your own eye doctor, especially if you're noticing real changes in your vision. But small, informed choices, made consistently, really can add up. Take care of your eyes. They carry more of your life than most of us ever stop to think about.